Well, Ms. Watkins, I want to thank you for coming in today. I know you get your care here at Greater Baltimore Medical Associates at Texas Station. And I think, as you know, we, GBMC Healthcare, are trying to build a better system of care, but not because we say it, but because the patient actually experiences it. So I know you've had some health issues and you've got your doctor here. Do you want to tell us a little bit about your experience?
I'd love to. My internist, Dr. Small, who I see probably every 3 months, because I have type 2 diabetes and I have some of the things that go along with that. And he introduced me to Virgie, the care manager here, who has just been wonderful. From the first moment I met her, I was struck with just how kind she was and compassionate. And I will never forget the first time I sat down with Virgie for an appointment. I explained to her what my problem areas were, and I was struck with how she listened to me. She heard what I was saying. She said, "Alexis, we just have to get you eating. Then we'll take it from there." That was so important to me because, like I said before, she heard me. I also had a need for a specialist, and she left the room. She came back with a computer printout with 5 doctors' names and phone numbers and gave it to me. I didn't ask her to do that. I mean, that was so helpful. It saved me the stress, you know, the time it would take to find. And she even went a step further and offered to call and make the appointment for me. Who does that?
Yeah.
Virgie
So it sounds like Virgie is part of a team that is trying to help you coordinate your care.
Yeah.
And I understand you also use the patient portal for communicating?
Yeah, which is really great. I mean, you think about years ago how things were done. It's archaic now. It makes it so easy. And I've experienced that with getting my lab results. I think it's really great that I don't have to wait, you know, for my next appointment or wait like a week or a few days. I can go right on, you know, into the portal, and I can see what my lab results were.
That's
you know,
great.
and it takes a little bit of the stress away. You wonder, how are those numbers going to be? You know, did I do better this month? The things that I'm doing to change, you know, especially with my diabetes, is it working?
That's wonderful.
So that's been really great.
That's what we're trying to do. We're trying to have the care be the way we would want the care for our own loved ones. And if you're a doctor or a nurse, you sort of understand how the system is supposed to work. So we're trying to deliver that for everyone.
And you know, that was another thing too about Virgie. When Dr. Small introduced me to her the first time, he said, you know, I'm on a fixed income. And Dr. Small said, you know, there's no charge for you to sit down with Virgie. How nice.
Yeah, great. Well, thank you very much.
You're very welcome.